it was fitting to have an opportunity to have Dr. Avegno provide you with a presentation where you could see the data as we see it and as we analyze it daily, but as we're now shifting into reopening the city, I just felt that it was very much appropriate to give the public some insight on the data sets that we look at, how we measure, where we've been, where we are, and use projections as it relates to where we are going. We have emphasized, as I mentioned throughout this process, that we will continue to follow the data. As we turn or loosen up the faucet a little bit, we have to always be in a situation where we need to tighten it back up and immediately should that happen. But again, letting the data drive where we go as a city, and with the priority always being public health and public safety. Dr. Avegno will walk through a breakdown of the major criteria we are looking at as it relates to, again, reopening our city in a phased approach and easing the guidelines. You will see what that data is showing us for each of the major gates to phase one, whether it's the testing capacity, which you've heard a lot about that, and even as we have kind of gone even deeper into communities and identifying hotspots and making sure that we're doing everything possible to not only meet our people where they are, but to get them the testing capacity that they need in order to ensure that we are no longer in community spread. Healthcare capacity, ICUs and ventilators, okay? That's also a criteria. The readiness for contact tracing and containment, meaning over the past 9 weeks or so, COVID-19 has kind of had us boxed in, as a community, as a city. And as we have saw the results in terms of how we are heavily testing, we're moving out of community spread, but we have to have the contact tracing in place so that we can box the virus in. So we're kind of turning that map around, how we've been boxed in over a 9-week period. As we move towards reopening, it has to be with the strategy being able to box in that virus to prevent community spread. And that's something that we have experienced very heavily in the city of New Orleans. You know that better than me, not only from the number of positive cases that we've had, but more importantly, from the deaths that we have suffered in our community, absolutely disproportionately affecting the African American community. We know that as well, with 360 of our residents having died as it relates to the Black community, 99 residents that we've lost that are tied to our Caucasian community, 3 residents that we've lost that are tied to our Asian community, and 8 that we have lost that are in the category of other or unknown. So 470 deaths, you just can't make it up. It's a real number, but they're real people and real lives that were taken from this community because of COVID-19. And that's why the public health of our community will always remain our top priority as we deal with this crisis, as we move out of crisis to recovery. We also need a steady decline in new cases, the downward curve, and we have been on that path for a good while now. We want to show you that. You'll learn more about it from Dr. Avegno. Today's update is meant to answer your questions about the data we are using really as to guide us throughout this. We'll be back tomorrow. I've scheduled a press conference tomorrow afternoon for where we will unveil a comprehensive guidance or guidelines from the city regarding the phased reopening that will commence beginning May the 16th. Later today, you will hear from our Governor, John Bell Edwards, regarding the state level guidance for phase 1. And of course, we will be listening and learning what those guidelines look like, and we will factor them in to our decision making as well. And we'll give you more again tomorrow. The state's guidance is a floor, baseline floor. It's not the ceiling. So on potential restrictions and safety precautions, we as a city have the right to chart our own course. Again, that's aligned with the data specifically for Orleans Parish, as we also are mindful about what's going on around us in our region, throughout the state of Louisiana, and neighboring states and cities. That said, we will continue to work with the governor's office on this, no doubt about it. The city guidelines for phase one, in some instances, will be more restrictive. We can prepare for that. And specific then statewide, we're looking to give you on tomorrow as it relates to the general guidance from the governor. So we'll go a little bit deeper, of course, as a parish, and factor in the guidelines, but tomorrow let you know what that specifically means for the city of New Orleans.